Laparoscopic hysterectomy for fibroid uterus. So laparoscopic hysterectomy is a major surgery and it's a minimally invasive surgery. So the patient is benefited in terms of faster recovery, less pain, less blood loss and lesser hospital stay. So fibroids is a condition where there are tumors which are arising from the uterus muscle, and this can range anywhere between like 8 centimeter uterus to a 30 to 35 centimeter uterus. The uterus size or the uterus weight can anywhere be between like 30 grams to 6 to 7 kg also in cases of big fibroids. So fibroids again is a very common condition where the uterus is again becoming bigger. It can lead to heavy bleeding, pain during periods, and like lot of pressure symptoms like difficulty in passing urine, passing motion, abdominal distension, where the patient can feel that there is a mass over the abdomen. So hysterectomy is a very safe procedure. It is a permanent cure for many conditions, and just like that, it is a permanent solution for the fibroids, where we remove the uterus entirely along with all the fibroids. So in fibroids, there are few things that we will have to discuss which is specific for the fibroids, especially in cases of laparoscopic hysterectomy. So because of the fibroids, the uterus will be distorted and the anatomy also will be distorted, because the fibroids can be any number. It can be ranging from one fibroid to almost like 200 fibroids that we see. So the commonest is like we see around 3 to 4 fibroids, and up till 15-20 fibroids is what we commonly come across. And because these fibroids can be located anywhere, it could be close to the adjacent structures like ureter or intestines or bladder, and we have to be very careful when we are doing the laparoscopic hysterectomy procedure. If the size of the uterus is bigger, then we can expect that the blood loss will be more, and we have to be ready to tackle the blood loss if it happens. Many a times in these fibroid cases, the woman will already be anemic because of the heavy bleeding. We have to improve her hemoglobin before we actually post her for laparoscopic hysterectomy. The other factors like blood pressure, diabetes, thyroid disorders and obesity, all these factors we will have to take into consideration before we go ahead with hysterectomy in such cases, where we have to take clearance from the anesthetist and a physician, where we check their chest x-ray, ECG, echo and all other blood tests to make sure that she is fit to undergo the surgery. So during surgery, we can come across few problems like delineating the structures, especially the ureter, major blood vessels and intestines if they are stuck to each other. And if the patient has had previous cesareans, then again dissecting the bladder may be slightly difficult. So we use various instruments like grasper, the myoma screw and shearer, tooth forceps, needle holders to do the procedure. And in these cases, sometimes the retrieval of the specimen, because it will be quite big, it has to be done through the vaginal route by a technique called either coring or lateral morcellation, which again requires expertise. So the duration of the fibroid surgery through laparoscopy can range anywhere from 20 minutes to 2 to 3 hours also, depending on the size of the uterus and time taken for morcellation. So these factors has to be discussed with the patient, that she will not be getting her periods and her fertility will not be there after the procedure, and if at all along with the fibroids, if there are any associated factors like ovarian cysts and all, if we remove the ovaries, then she will attain menopause. So this is extremely important that we discuss according to her age as to what her wish about the hysterectomy in cases of fibroids is, like whether myomectomy is the choice or whether hysterectomy is the choice, and also recurrence of the fibroids in case if there is any. So usually the fibroids will not recur, but because they are estrogen dependent tumors, as the woman advances, if she is young, then definitely the fibroids can come back again, and hysterectomy offers a permanent solution. So the patient has to stay in the hospital just for 1 or 2 days, and she has to take off from her routine for 1 week to 10 days, and the recovery will be quite fast. She will experience some amount of pain and discomfort post-operatively, and she may have slight bleeding. There may be complications like adhesion formation, bleeding, injury to the adjacent structures, and also there could be the risk of thrombus formation if the surgery is very prolonged. So antibiotic infection also could happen, and antibiotics is a must in case if there is any infection, and we'll have to follow up the patient once after 7 days and also once after 1 month after the procedure. So laparoscopic hysterectomy is a very safe option in cases of fibroid uterus, and this is become very popular now. It requires expertise, it requires skill from the surgeon, and also availability of the latest equipments. And nowadays we have 3D laparoscope, which again adds advantage to the perception of the depth. So laparoscopic hysterectomy can cost anywhere between 60,000 to 3 lakh rupees depending on the complexity of the case and whether associated any other procedures are done in, and it also depends on the place where the woman is undergoing the hysterectomy and the surgeon from whom the woman is undergoing the hysterectomy. Any other doubts, please reach out to us on this number. Thank you.